All right, so let's take a look at white blood cells. Now, white blood cells are also known as leukocytes. Leuko means white, white cells. So these are cells that help fight infection. They're mostly found outside of the circulatory system. We look at this picture here, we're seeing red blood cells here, those are platelets there, and these here are white blood cells. Now, I know they don't look white on here, but we stain them so we can see them easier. All right, let's take a look at types of white blood cells. So this is showing the 5 different types of white blood cells. The first group are called granulocytes. So granulocytes is a white blood cell that has a granular cytoplasm. They are much larger than red blood cells. You can see red blood cells by comparison there. But they have short lifespans, only about 12 hours. The most common of these is this one here, and that is a neutrophil. So a neutrophil is a white blood cell that phagocytizes bacteria, fungi, and some viruses. So it's a phagocytic cell. These guys are typically first to infection, and the reason is they're the most abundant. All right. So next are these red ones right over there. That's an eosinophil. So these are white blood cells that are going to moderate allergic reactions, and they're also going to defend against parasitic worm infections. Next are basophils. So this is a basophil right here. They have dark granules in their cytoplasm, so it's hard to see the nucleus on there. All right. So basophils, these are white blood cells that release histamine and heparin. Now histamine is an inflammatory chemical. All right, it's a vasodilator, and heparin inhibits blood clotting. So histamine and heparin increase blood flow to damaged areas. So if you get a cut, that basophil will release these histamines, heparin, and so blood can flow out. And that way we can wash out any pathogens that might have gotten in there. Next are the agranulocytes. So these two are the agranulocytes. So these are white blood cells that do not have a granular cytoplasm. So the first are monocytes. That's a monocyte right there. These are white blood cells that phagocytize bacteria, dead cells, and other debris. So they're another phagocytic type of cell. They become macrophages when they move outside of the circulatory system. Lastly, here are lymphocytes. So lymphocytes are our immune cells. So where these guys here are kind of generalists, they're going to fight against any type of pathogen that gets into us, we are going to make specific lymphocytes for a particular pathogen. And we have two types of lymphocytes. We have T lymphocytes, also known as T cells, and these are white blood cells that directly attach to the microorganisms. So in doing so, they're going to kill those microorganisms. They can also kill tumor cells, virus-infected cells, and also transplanted cells. The other type are called B lymphocytes, or B cells. And those are the cells that are going to produce antibodies. All right, let's look at our white blood cell count. I don't have a slide of this. The normal range for white blood cell count is between 5,000 and 10,000 cells per millimeter cubed of blood. So let's look at abnormal situations. So if we don't have enough or too much. So one is called leukocytosis, and that's where you have a high white blood cell count. So your total number of white blood cells is above that 10,000 millimeter cubed of blood. So this is indicative of leukemia because those cancerous cells, so leukemia is a blood cancer, those cancerous cells are white in appearance. It can also be an indication of infection. So, you know, if you have an infection, your body's trying to fight it off, so you're going to produce more white blood cells to do that. You can also get this by exercising a lot. That's going to boost the amount of white blood cells that you produce. And you can also have this by just the loss of body fluids. So if you get a cut, your body starts to produce more of this. Okay, so the other end of this is leukopenia. Leukopenia is a low white blood cell count. So here your total number is below 5,000 cells per millimeter cubed of blood. And this indicates a disease. So this is measles, mumps, and AIDS are diseases that actually attack our white blood cells and lower the amount of white blood cells that we have. All right, so let's move on to platelets. So here's showing platelets right there. Platelets are also known as thrombocytes. And these are cytoplasmic fragments that function in coagulation. So these guys arise from this cell here called a megakaryocyte. So megakaryocytes are large bone marrow cells that give rise to platelets. And basically what they do is they release pieces of their cytoplasm, and that's what the platelet is, these pieces of cytoplasm. We have anywhere from 250,000 to 400,000 platelets per millimeter cubed of blood, and that's the Goldilocks zone. If we have more than that, our blood can clot too easily, which we don't want. It can develop a blood clot, clog up one of our blood vessels. If we're below 250,000, our blood may not clot so well, and we can bleed easier. Let's look at functions of platelets. So this is showing like in a clot here. So functions of platelets. They secrete vasoconstrictors, so that's going to cause blood vessels to decrease in their diameter, get smaller. They stick together to form platelet plugs. They're going to secrete procoagulants, so those are clotting factors. They're going to secrete chemicals that attract neutrophils and monocytes, so bringing those to the area, because if there's damage, we want to clean up that damage. All right, clean up any pathogens there as well. They're also going to be phagocytic as well. So they're going to phagocytize some bacteria. And they're going to secrete growth factor, which is going to stimulate mitosis of fibroblasts. So that's going to help, and also smooth muscle. So that's going to help repair damaged blood vessels. All right, so let's take a look at hemostasis. This is the cessation of bleeding, so stopping bleeding. So let's move on to our next picture here. So the first thing is known as a vascular spasm. This is a prompt constriction of the broken vessel. So you can see this vessel here on the end has gotten smaller than it was over here. So that's due to that vascular spasm. This is caused first by the pain receptors, then the platelets help cause it. Next is the platelet plug formation, so that's what we see here. So here the platelets will adhere to the damaged area by pseudopods. So if I go to the next picture here, you can see these pseudopods. Pseudopods literally means false feet. So they're sticking those out, sticking to things, all right? So the platelets contract and draw the vessel together. Now, I do want to point out typically an unbroken blood vessel will secrete chemicals that prevent platelets from sticking. But if we have some damage here, now those platelets can stick to that area. So they can't stick to the undamaged area. Okay, so back to this here. So the platelet's going to secrete a few chemicals. They're going to secrete serotonin, which is a vasoconstrictor. They're going to secrete adenosine diphosphate, or ADP, and that's going to attract more platelets to the area. And they're also going to secrete thromboxane A2, which promotes platelet aggregation and vasoconstriction, so further vasoconstriction. The last part here is coagulation, so the blood clotting. So what's going to happen here, and I'm not going to go through all the steps involved here, but you can see there's many chemical reactions here that are going to convert fibrinogen into fibrin, all right? And so fibrinogen is converted into fibrin, and so this is what you see from that. So fibrin is a sticky protein. And so here, platelets and red blood cells are going to stick to that fibrin, and that's going to form the clot. So what you see there, all right?